is Melissa Wilson, and I'm going to show you how to properly do an assessment on a newborn. First thing I'm going to do is wash my hands. After I wash my hands, the next thing I'm going to do is check the baby's armband just to make sure that it's who they are. Alright, I'm going to take the baby's vitals. So the first thing I'm going to do is check her heart. Listen for any kind of murmur, and then go ahead and check her apical pulse. The normal rate is going to be between 100 and 160. And at this time I can also check her respirations. And I'll check them for a minute, and they should be anywhere from 30 to 60. I'm going to go ahead and take her temperature. So you're going to do this under the arm. And as you're taking it, put your hand over it. Okay. Next, I'm going to check her vowel sounds. Make sure they're present in all 4 quadrants. You also want to listen for breath sounds to hear if they're clear or there's any kind of crackling. That could indicate that there's some fluid in there. So the next thing I'm going to do is check her head. You're going to check for molding, and that could be from the baby coming out of the birth canal if it's shaped at a point. Also check her fontanelles. There's an anterior and a posterior. Just want to make sure that there's no bulging from those. And then her sutures. You also want to check those. Make sure there's no overriding of the suture lines. And then you also check for any scrapes or scratches on her head. Looks good. Okay, so the next thing I'm going to do is check for eye placement. That when looking at the face, 1/3 should be an eye, 1/3 should be the bridge of the nose, and then the other third should be her other eye. And it looks like everything's even and good. I'm going to check for discharge and to see if she's got red eyes, which that could be subconjunctival hemorrhage. So that looks good. If she's got superior, in the superior fold, if she has an intercampus of the eye, that could indicate Down syndrome, and that looks like it's okay. I'm going to move on and check her ears. You're going to want to check the position. If they're lower set, that could indicate, or that could just be that it's abnormal and indicate prematurity. You're also going to want to check the cartilage to see if it recoils. If it recoils slowly, that could indicate prematurity as well. Then I'm going to go ahead and move to her nose. You need to make sure that you can feel air move in and out of both nostrils. And then I'm going to check her mouth. You're just going to want to insert one finger inside of her mouth to check her palate. And then also check to see if she will suck on your finger. You want to make sure you have gloves on when you do that as well. Okay, so moving down onto her neck, you're going to check for any kind of masses or anything abnormal. Check for a range of motion by turning her head side to side. And then you're going to come down and check her clavicle just to make sure that's intact and it wasn't broken or anything from being in the birth canal. So from there you're going to check the skin, and you want to keep her covered up to keep her warm, so just undo the parts that you're looking at the time. So you're going to check for rash, vernix, lanugo, which is fine little baby hair, any kind of bruising, or discoloration anywhere. You're gonna want to check for jaundice as well, and that is a yellow color of the skin. It's from an increase of bilirubin, and you're gonna want to blanch 5 different areas. The first is going to be the forehead, the chest, the abdomen, the inner thighs, and then check her eyes for a yellow color. The next thing that you're going to do is check for respiratory distress, or to see if she has unlabored breathing. The signs of respiratory distress are going to be nasal flaring, retractions, grunting, seesaw respirations, and apnea. After you do that, you're going to go ahead and check her abdomen. Just see the shape of it and see if it's soft. And then while you're down there, check the umbilical cord. You need to check the level of drying and see if there's any color of discharge or anything that looks abnormal. So the next thing you're going to do is check the genitals. For the female, you're going to want to check the labia and to see if there's any kind of discharge or any bleeding. The males, you're going to want to check the testes, the meatus, and the foreskin. To check for the testes to see if they've been descended, you're going to want to push down on the inguinal canal. To check the scrotum, you are looking for rugae, which is wrinkles and folds. Lots of rugae could be a sign of immaturity. Then you're going to want to lift the penis and look at the meatus. If they're not circumcised, you'll need to pull it back, pull back the foreskin to look at just the tip. And then if they've been circumcised, you're going to want to assess the circumcision and make sure that everything looks okay with that. Go ahead and get her covered back up here. So the next thing you want to do is check for the tone, muscle tone. So basically you're going to push the baby's arm down, and if it comes back up, that's what you want. But if it doesn't, it could be a sign of prematurity. You're also going to want to look for palmar creases. When they have those, that means they've matured enough. And you're going to look at the soles to see if they've got the creases in the soles. The next thing you want to do while looking at the feet is the Babinski reflex. So you're going to want to run your finger from the bottom to the outside of there, and the toes should flare out. So that's all for the front. Then you're going to want to turn the baby over. Put the baby on its tummy. And you're going to want to check the spine. Just make sure that it's smooth and nothing abnormal. You're going to check the gluteal cleft. You're checking for dimples or little tufts of hair. If those are present, that could be a sign of inadequate spinal closure. In the hips, you're going to check for the gluteal smile, and that's just like the hips looking even. Make sure they're both symmetrical. And the next thing you're going to do is turn the baby back over and do what they call a Moro reflex. So basically you're going to clap your hands and the baby should put the arms down, then back up to their side, and they'll kind of make a C with their hands. That's pretty normal. And then after you do that, you're just going to kind of check their behavior. Were they awake, sleeping, crying, showing signs of discomfort? Just kind of check their overall general behavior. And then you'll want to check when their last BM was and their last void, and then the next time that they're due to feed. And if you have any abnormal findings, you're going to report that right away to your instructor or the nurse taking care of that baby for the day. And that's it.